As a parent, I remember this well. Football workouts are right around the corner now, and a sidelining injury is the last thing a player wants, or a parent for that matter. Many will try to play through the pain, so knowing when to stop is key. Doctors Leonard Wright from the Synapse Human Performance Center and Davis McAllister from Parker University Sports and Performance Clinic are here to talk about prevention and sports injury warning signs. Good morning.
Good morning.
This is a tense time for parents. I know, I've been there. So, Dr. McAllister, first of all, what are some of the most common injuries with football?
So most of the common injuries that we see are going to be muscle strains, such as a pulled hamstring, quad, calf strain. We'll see sprains of the knee and ankle from missteps when they're trying to change directions or rolling their ankle. We'll also see elbow and shoulder injuries from repetitive hits and traumas. Low back pain is a common issue just from the repetition of the sport itself. Neck injuries such as stingers from bad tackles can happen. And then there's that one injury that nobody really wants to think about, is that potential for a head trauma that would result in a diagnosis of a concussion.
This is the thing that always scared me to death. So, Dr. Wright, what are some of the signs of concussion?
Well, we want everyone to be aware of the more serious signs, so things that would require an immediate referral to emergency services, things like loss of consciousness of any kind, nausea, vomiting, or even changes in pupil size can be indicative of a more serious head injury, things that we don't see at our clinic, but things that you need to be aware of. Other things that we want to be aware of, things that we do see in our clinic, signs and symptoms, things include like headaches, dizziness, difficulty with sleep, difficulty concentrating in school, those things, you start to see those pop up after a head injury, and they can be even days or weeks following that head injury.
So what are the treatment options for concussion at Synapse HPC?
Yeah, so we have an awesome integrative team of physicians that we have. Chiropractors like myself, Dr. McAllister. We have our medical director who's a neurologist, Dr. Paul Harris, and we also have Dr. Scott Schmidt, who can all address the individual needs of a patient that comes in. We do a very detailed examination process that identifies all of the different things that may be needed for that patient to have a full recovery, things like training, cognitive training like you see here, oculomotor training, and balance training can all be incorporated to help an individual out.
So, Doctor, going back to sports injuries and prevention, what are some of the options that are available for athletes and their parents?
So going back to the integrated team that he referenced, our nurse practitioner is really good with helping with acute injuries as well as pain management. And then our doctors also have backgrounds in coaching and strength and conditioning. And we combine that with chiropractic as well as modalities such as shockwave therapy, cryo, myofascial release, acupuncture, cupping, and exercise rehab therapy in order to be able to get a player back on the field as quickly as possible. And then regarding prevention, we can do functional movement assessments that can allow us to be able to assess an athlete for potential risk of certain types of injuries. And then most of your college and professional athletes are going to have people like us on their team to help maintain them throughout the season as well as recovery after the season. So we would love to be able to be a part of their maintenance and recovery team.
Okay, so if I'm a parent sitting out there thinking, I need to find out more about this, where do people go for information?
So you can go to our website at parkerstrength.com. You can also call us at 214-902-3400.
Thank you so much.
Thank you.
Appreciate your time this morning.
Absolutely.
Again, go to parkerstrength.com or call 214-902-3400 to learn more about the Parker University Sports and Performance Clinic, and synapsehpc.com or call 214-902-3400 for more information.